We do not believe that the PolyMet project FEIS adequately assessed the health impacts of the project. Chapter 7.3.4, Human Health Considerations, which is this, barely contains 5 pages out of the 3,576-page document. An adequate assessment of baseline health in the affected communities was not undertaken. Minnesotans should be concerned about mercury and lead. A Minnesota Department of Health study in 2011, that's been previously referenced, reported that 10% of newborns born in the Minnesota portion of the Lake Superior Basin have elevated blood mercury levels. As a physician who cares for pregnant women, infants, and children, I received a personal letter from the Minnesota Department of Health stating the study results and with this warning, and I quote, "Exposure to mercury may have developmental consequences for fetuses, infants, and young children. Methylmercury exposure from maternal fish consumption can adversely affect the fetal brain and nervous system. Impacts on cognition, memory, attention, language, and fine motor and visual spatial skills have been seen in children exposed to methylmercury in utero." We know from a study released in August of this year, recent study, that Minnesota leads the nation with having 10.3% of children under age 6 with elevated blood lead levels. The Minnesota Health Department calls these infants and children human canaries, those who may see symptoms first and call out the signs of potential trouble. A health impact assessment would have adequately assessed the baseline health status of these affected populations and assessed potential health impacts to these populations. It would have recommended design alternatives to improve health or manage deleterious health effects. It would have reported the findings to inform decision makers and stakeholders. It would allow monitoring of the health impacts of the affected populations through time and allow evaluation of how well the objectives of the HIA were met.